Okay, thank you very much. And again, distinguished guests, partners from various economies, esteemed colleagues, friends, ladies and gentlemen, good morning and mabuhay. Yeah, so we welcome each and everyone to our health policy dialogue, which is subtitled Healthy Asia Pacific 2020 Amid Disasters and Outbreaks, Lessons Learned and Promising Practices. So this is a full-day event, and this is based and anchored on the fourth high-level meeting statement, which endorsed the Healthy Asia Pacific 2020 initiative. The Healthy Asia Pacific initiative provides key guidance for actions and conditions to the sustainable economic development of the region. Among the proposed areas of focus included improving emergency preparedness, surveillance, and recovery systems in the APEC region. So this forum or policy dialogue is initiated by the Health Working Group. And we're so happy that you're all here with us today. We have three objectives. One is to discuss the economy's experience of its health system's ability to respond to health-related security and humanitarian emergencies, identify potential areas where economies can integrate lessons learned, best practices in other contexts, to improve preparedness capabilities and increase the resilience of the healthcare system. Identify opportunities for intersectoral, inter-economy, inter-regional cooperation in the midst of disasters and emerging infectious diseases and outbreaks. Again, we welcome each and everyone. I'm Maylene Beltran. I head the Bureau of International Health Cooperation of the Philippine Department of Health, and I serve as the Vice Chair for the Health Working Group. So we'll have a full day session today, and there will be two parts to be able for us to meet our objectives. The first part, and which is the first session for the morning, would cover our experiences on the tropical storm Haiyan, which really hard hit the Philippines. Little less than 2 years ago. And the other one would be in the afternoon, wherein we will be tackling issues and experiences and lessons learned on how we're responding to emerging infectious diseases such as Ebola, MERS-CoV, and others. So let me then go and introduce the one who will officially welcome us. It will be Assistant Secretary Pauline Jean Rosel Ubial, who's the Assistant Secretary of the Philippine Department of Health, and who used to be the cluster head of the Visayas region when the typhoon Haiyan struck the Philippines, and also during that time when an earthquake happened in one of the provinces, also in the Visayas region. Without further ado, let me give the floor to Assistant Secretary Pauline Rosel Ubial.
Thank you, Director Maylene. To our distinguished guests, speakers, participants, I'd like to recognize Undersecretary Fama of the National Disaster Risk Reduction Management Council and Dr. Julie Hall of the World Health Organization Country Office. Dear colleagues, welcome to our Health Policy Dialogue on Achieving a Healthy Asia-Pacific 2020 in the midst of disasters and emerging infectious diseases. This theme is most relevant for this 2015 APEC, not just because of where it is being held, but when it is being held. Due to climate change and the impact of global warming, increased carbon emissions, we are now faced with stronger storms, earthquakes, tsunamis, and other calamities. In the Asia-Pacific region, we comprise 50% of the Earth's surface and 40% of the world's population. However, we get 70% of the world's natural disasters. So you see that we are the disaster capital of the world. The Pacific Ring of Fire is exactly where the Asia-Pacific economies are. However, such statistics are proven time and again as our norm. I recall when the senior officials of the 21 APEC member economies launched the agenda for 2015 APEC, that was way back December 2014, here in the Philippines. It was originally planned to be held in Legazpi City, southern part of the Luzon Island. However, it was immediately moved to Manila because Typhoon Ruby at that time was expected to hit Albay province, where the original venue of the meeting was supposed to be. So that opened the 2015 APEC discussions. And it also happened just a year after the country experienced Typhoon Haiyan devastation in the Visayas. And we all know, based on history, that Haiyan is the strongest typhoon or storm to make landfall in recent history, packing winds of more than 265 kilometers per hour. Now, we hope that today's session will give us a good perspective of what happened in Typhoon Haiyan and also give us the valuable lessons learned from this particular experience. Now, the third senior officials meeting is being held this week, and it has been able to contain, Korea has been able to contain the MERS-CoV epidemic. However, we are along the rest of the world awaiting for the end of the Ebola outbreak in West Africa. So as we are facing storms, we are also facing epidemics and outbreaks of communicable diseases. With this, at our stage, it is not surprising that among the priority agenda of 2015 APEC theme of building inclusive economies, building a better world, is that of building sustainable and resilient communities. The theme is a constant reminder that economic development and growth needs to include all of our people, a whole of government and a whole of country approach. Unfortunately, whether our economies stand at the economic development spectrum, we all acknowledge that poverty and health inequities exist within each of our economies. The reality is further aggravated in the face of public health emergencies. In the face of these emergencies, the poor are the most vulnerable and disproportionately affected. As anxiety, fear amidst an infectious disease outbreak puts the people's daily living at a standstill, its immediate resolution remains an impossibility in poorer economies having a resource-constrained healthcare system. However, with each of our economy acknowledging that we are living as a global community, a collective and supportive response have been proven to be proverbial silver lining amidst the storm. We experienced this during Typhoon Haiyan, where when we were at Tacloban City Airport, we saw so many different aircrafts landing in that airport from the United States, from Australia, from Canada, and so many other economies. I cannot mention all of them, but we are indeed very grateful that experience has shown us that we are not alone, that the entire world is really there and willing to help any country that has been devastated by a natural calamity. Knowing that the response requires a whole of government and a whole of society approach, we acknowledge other APEC working groups' disaster-related initiatives, such as the Emergency Response Travel Facility Initiative, the Business Continuity Planning of SMEs, to name a few. Meanwhile, for us in the health sector, this policy dialogue is being conducted as we put forth to our leaders the roadmap for a healthy Asia-Pacific 2020, setting the initiative on what we will all now call as the new normal. The policy dialogue takes on one of the critical actions identified in the proposed APEC roadmap for a healthy Asia-Pacific 2020. That is, providing a stage wherein we as economies share the lessons that we learned and practices that worked in facing disasters and emerging disease outbreaks within our home front and as part of a global response team. With this note, I welcome you all, colleagues and dear friends, and hope that you will enjoy your stay here in the Philippines, as Forbes magazine actually ranked the Philippines as the friendliest in Asia and the 8th friendliest in the world. And also Lonely Planet called us as among the ebullient and easygoing people anywhere in the world. So enjoy the Filipino hospitality. We hope for a fruitful day ahead of us, and mabuhay to all of you.
Thank you very much, Asek Pao Ubial. That should then set the tone for a lively and interactive day ahead. Okay, so before proceeding, let me acknowledge the presence of our partner economists. And as I call your economy, can you please stand up? May I call on our friends from Australia? Thank you very much for joining. From Brunei Darussalam. From Canada. Thank you. From Chinese Taipei. From Indonesia. From Malaysia. Thank you. Of course, from the Philippines. See, we're also populating the room. Our friends from Singapore. And from US. And of course, Matthew would be part of our, as a speaker. And then, of course, we have, David Wu from the APEC Secretariat. Any other, and we have friends from LSIF. Oh, there's Michael. Life Sciences Innovation Forum. Thank you very much for joining us. Anyone whom I have just missed? Okay, so again, thank you very much for being with us today. Now, let me introduce the panel of PowerCast speakers we have this morning for the part one of our day's event, the Healthy Asia Pacific 2020 in the Midst of Disasters, Philippine Experience in Typhoon Haiyan, Lessons Learned and Promising Practices. So we have actually 5 speakers. We have a slight modification of the program. We'll have first an overview on Typhoon Haiyan to be given by Director Gloria Balboa, who is currently the Director of the Health Emergency Management Bureau of the Philippine Department.